Welcome back to the another session of Cancer Care at American Oncology Institute. I am Rajesh Vasisht. Today we have with us Dr. Mangesh Patil. Dr. Mangesh Patil is consultant radiation oncologist at American Oncology Institute, Nagpur. Dr. Mangesh Patil has received specialty training in radiation oncology and completed his MD in radiation oncology from prestigious Tata Memorial Hospital in Mumbai. He completed his MBBS from Government Medical College, Nagpur. He has been honored with International Young Researcher Award by International Association for Study on Lung Cancer. He has special expertise in stereotactic radiosurgery, stereotactic body radiotherapy. Today we will discuss everything about brain tumors. Let's begin the session. Welcome, Dr. Patil.
Thank you, Rajesh.
Dr. Patil, let's begin with knowing what is brain tumor.
Brain tumor is a growth which occurs due to defect in the normal functioning of the cells in the brain and cells which supports the brain cells. Every cell has its dedicated function which is regulated by a cell cycle. Some of the cells, because of the changes in DNA of the cell, skip the normal functioning of the cell cycle. They rapidly multiply and form a growth which may be cancerous or non-cancerous.
So, Doctor, what are the common symptoms of brain tumor?
The common symptoms of brain tumors are according to the size and location of the tumor in the brain. Headache is the most common symptom of brain tumor. Nausea and vomiting is often associated with brain tumors. Some of the symptoms of brain tumors are according to location. For example, if the brain tumor is near to the optic structures, then patient may have blurring of vision, double vision. Patient may have seizures. Patients may have problems with the memory. Patients may have problem with the behavior. Patient may have altered behavior in the public, that is social behavior also. Patient may have problem with the walking balance. Patients may develop paralysis in any of the extremities. So these are the common symptoms associated with the brain tumors.
Right. Dr. Patil, what are the causes of brain tumor to develop?
For brain tumors, there are no specific causes, or in other words, we have not been able to find out the causes of brain tumors. Contrary to other cancers, for example, tobacco consumption causes oral cavity cancer, laryngeal cancer, or lung cancer. So we do not have specific causes about brain tumors. Brain tumors develop because of the changes in the genetic material, that is DNA of brain cells or supporting cells. But there are small proportion of brain tumors which are hereditary. That means parents pass altered genetic material to the child, which may lead to the development of cancer in the child. But there are no specific causes as such which have been associated with the brain tumors. There are some, now newer studies are saying that there are some mutations in the cells which we are trying to find out, and if we can find out these alterations in genetic material, that is mutations in the DNA, then we can probably find out the cure for these brain tumors. There are few proportion of genetic mutations which have been associated with brain tumors, and the research work is going on to find out in details that what exactly we can do about these tumors.
Dr. Patil, are brain tumors always cancerous?
To answer your question, there are two types of brain tumors. One are benign and others are cancerous. So benign tumors tend to grow very slowly, sometimes few mm per year. On the contrary, the cancerous tumors or malignant tumors, they tend to grow very fast. They grow rapidly, and the symptoms occurs because of the rapidity of growth. Some of the brain tumors develop in the primarily in the brain only, and few other brain tumors migrate from other parts of the body to the brain, which are known as secondary neoplasms in the brain. So to know the benign or cancerous nature of brain tumors, we have a grading system. So brain tumors are graded from grade 1 to grade 4, similar to the staging system for the cancers in the other parts of the body. So grade 1 tumors are benign tumors and grade 4 tumors are malignant or cancerous tumors.
Sir, how are brain tumors diagnosed?
Once patient comes to the hospital with the symptoms, we take complete history of the patient. We perform a thorough neurological examination. Imaging is required. We perform CT brain for the patient. MRI brain with contrast is usually required to diagnose a brain tumor completely. There are some functional imaging in the MRI like spectroscopy and perfusion, which are needed to know the grade of the tumor or the type of the tumor. Sometimes special scans are required. For example, PET CT scan is required to know the exact nature of a tumor we are dealing with. Once radiological examination is complete, we have a fair idea about the nature of the tumor and the grade of the tumor. Then we need to confirm our findings with specimen of the tumor. Once we have a radiological confirmation of a tumor, we need to have a biopsy from the tumor to completely diagnose the brain tumor, know the type of the brain tumor and grade of the tumor. So histopathological examination is mandatory to know tumor thoroughly before we go ahead with the treatment. Some of the tumors are at difficult locations wherein surgery or biopsy is difficult to perform. In those cases, stereotactic biopsy or endoscopic biopsy is performed. So at these sites where biopsy is difficult to perform, the radiological examination helps us to diagnose a tumor. So what we understand is a diagnosis of a brain tumor is a radiopathological diagnosis. So it has an equal contribution from radiology and equal contribution from pathology. When one of these modalities is insufficient to diagnose accurately, then the other modality helps us to completely diagnose and grade a brain tumor.
Sir, what are the treatment options for brain tumors?
Surgery and radiotherapy are two main treatment options for brain tumors. Sometimes chemotherapy is required. In surgery, neurosurgeon tries to remove as much as the brain tumor possible from the body. Prognosis of brain tumor patient depends on the extent of removal of the brain tumor. So good surgical resection is required for the cure of brain tumor patients. In areas where it is difficult for a surgeon to, in parts of the brain where it is difficult for neurosurgeon to perform surgery, stereotactic radiosurgery is a good treatment option. Stereotactic radiosurgery is an advanced form of radiotherapy in which in a single session or a few sessions of radiotherapy, high dose of radiation is delivered accurately to the brain tissue so that normal surrounding tissue receives as low dose as possible.
Sir, what are the recent advances in radiotherapy?
Radiotherapy is a very old form of therapy for the treatment of cancer. In radiotherapy, X-rays or gamma rays are directed towards cancerous cells or tumors, and these radiations are ionizing radiations. They bring about DNA damage into the tumor cells or cancerous cells. This DNA damage causes death of cells, and this is how radiation works. The recent advances in radiation technology are image-guided radiotherapy, volumetric modulated arc therapy, stereotactic radiosurgery, stereotactic radiotherapy, stereotactic body radiotherapy. We will try to learn in simple language about these newer radiation technologies. In image-guided radiotherapy, we perform CT scan or X-ray daily in each session of radiation so that we can accurately direct our beam of radiation to the tumor, preventing damage to the surrounding normal tissue so that the side effects are very less. So this image guidance in the form of a CT scan or X-ray in each treatment session helps the patient in terms of quality of life. Volumetric modulated arc therapy is a form of IMRT, intensity modulated radiotherapy, in which radiations are conformed or shaped according to the tumor size and location so that the normal surrounding tissue gets minimum damage. Stereotactic radiosurgery, as I mentioned earlier, is an advanced form of radiotherapy wherein high amount of radiations are delivered to the tumor in a single session, which is known as stereotactic radiosurgery. The biggest advantage of a stereotactic radiosurgery is that we can accurately localize the tumor in the brain and deliver high amount of radiation to the tumor only and prevent damage to the normal surrounding tissue. This high amount of radiation causes damage in the DNA of our tumor cells and it results in the death of tumor cells and cure and control of these tumors or cancers. When stereotactic radiosurgery is carried out in multiple sessions, say 2 sessions or 3 sessions, which is typically up to 5 sessions, then it is known as stereotactic radiotherapy. So stereotactic radiosurgery is performed for very small tumors. If the tumor is big in size, then stereotactic radiotherapy is required, which is approximately 2 to 5 sessions, depending on the tumor location, size and type.
Sir, can brain tumors be cured?
Cure is a relative concept in cancer, but yes, there are some brain tumors which can be cured and others which can be controlled. Low-grade tumors do not reoccur early, which is known as recurrence. High-grade tumors tend to recur earlier than the low-grade tumors. Cure is also dependent on the amount of resection which has been done during surgery. It is also dependent on the quality of radiotherapy delivered and the completeness of the treatment. There are advancements in pathology wherein we perform histopathology examination and a molecular examination on the tumor tissue and the immunohistochemistry examination. These parameters, these advancements in pathology helps us in guiding the treatment and the completeness of the treatment. So depending on the immunohistochemistry and the molecular pathology, we need to tailor our treatment according to the individual needs of a patient, according to the patient's age, patient tolerance to the individual treatment, and the biology of the tumor, which is guided by the ISC and the molecular pathology. There are newer techniques in which we try to find out the alterations in genetic material and direct our treatment according to the changes in the genetic material of the tumor.
Sir, are there any risk factors that increases the likelihood of developing a brain tumor?
Yes, there are some risk factors. As I said earlier, we have not been able to find out the causes for brain tumor. But there are some risk factors, for example, age. Few of the brain tumors tend to occur in elderly population. Glioblastoma is one such tumor which is mainly found in older patients. There are some tumors which are known as embryonal tumors which occurs in childhood. For example, medulloblastoma is one such tumor which is common in children. There is another risk factor. Which is race. So gliomas tend to occur in white population and meningiomas tend to occur in black population. But there are no convincing studies about these risk factors. Other risk factor is changes in the genetic material. So there are some syndromes, which syndrome is a conglomeration of various conditions occurring together. So there are syndromes, for example, neurofibromatosis 1, neurofibromatosis 2, Lee-Fraumeni syndrome, and others, in which there is an increased tendency of the formation of tumors in the body. Other risk factors is the changes in genetic materials. Some of these changes in genetic material may be hereditary. For example, retinoblastoma. There are other syndromes which are associated with the increased formation of brain tumors in the body. For example, neurofibromatosis 1, neurofibromatosis 2, Van Hippel-Lindau syndrome, Lee-Fraumeni syndrome. In these syndromes, there is a tendency for the formation of tumors in the various parts of the body occurring together or at different times in the same individual. So it is important whenever we find out a patient with a tumor characteristic of a particular syndrome, then we should screen this patient to find out other tumors in the body so that we know about the diagnosis of these syndromes and the occurrence of tumors in the other parts of the body.
So can brain tumors be prevented?
As I said earlier, we have not been able to find out the exact causes and the risk factors for brain tumors. So as such, there are no preventive strategies for brain tumors. But as I mentioned earlier, for the patient with hereditary tumors or syndromic tumors, we can screen these patients to diagnose these patients early.
So what are the prognosis for someone diagnosed with brain tumor?
So prognosis depends on the type of the brain tumor, grade of the tumor, the location of the tumor, the tolerance of the patient towards the therapy which is planned, and the complete needs of therapy. So prognosis is a conglomeration or the output of all these factors together. Low-grade tumors, as I said earlier, will not occur early. They will have a long life and their treatment is also short, so the quality of life is generally good. For high-grade tumors, the chances of reoccurrence are high. So the prognosis, for example, glioblastoma is one such tumor in which the prognosis is not good. But then medical science is continually trying to find out better treatment strategies for tumors in which the prognosis is not good. As I said earlier, we are trying to find out treatment options which are focused according to the needs of a particular patient, which is known as precision medicines. As the oncology science advances, we may find out new driver mutations or alterations in genetic material for which we may have a cure. Currently, we have best neurological services and the advances in radiation oncology to guide patients for their treatment and the best chance of cure.
Dr. Patil, thank you for guiding us on brain tumors, and it was a great learning for us and for our audience. And thank you viewers for watching our Facebook live session. Stay tuned and please subscribe our channel. If you have any queries, please reach out us through Messenger or post them on our comment section. Thank you so much. Be safe.
Thank you.